Navigating healthcare, well, it can feel a bit like finding your way through a maze sometimes, can't it? Especially when you're trying to figure out what high-quality safe care actually means.
Absolutely. And when it comes down to something as critical as medication, those complexities, they suddenly become very personal, very fast.
Right. It's easy to feel like you're just, on the receiving end. But understanding how hospitals actually build quality in,
Yeah,
that seems key to feeling a bit more confident.
exactly. More empowered, really.
Okay, so for this deep dive, we've gathered quite a bit of material. We looked at global standards, things like Joint Commission International,
FBI, yeah.
and national ones like India's NABH, plus some detailed guides on medication monitoring, and even a look at healthcare consultancies that help hospitals get up to scratch.
So our mission today is really to unpack all of that. We want to see how hospitals aim for those high standards, but just as crucial is understanding where you fit in.
You, the patient, or the caregiver.
Right. Where does your role become absolutely vital for safety, especially when we're talking about medicines?
All right, let's start at the beginning then. How does a hospital even begin to ensure quality and safety on a large scale? It must start with setting some kind of standard.
It really does. And that's where accreditation bodies come in. You can think of them as independent evaluators. They set these really rigorous standards, and then they actually go into healthcare organizations to see if they're meeting them. It's a way to benchmark quality
Against recognized best practices.
Exactly.
And globally, one name that keeps popping up is Joint Commission International, or JCI.
Yes, JCI is definitely a major player. Their mission statement is quite powerful, actually. It's about enabling and affirming the highest standards of healthcare quality and patient safety for all.
For all. So making safe, quality care possible everywhere.
That's the goal. And they operate on a huge scale.
Yeah, I saw the numbers. It's not just a few places.
No, not at all. Over 70 countries, more than 1,000 accredited or certified programs. They've got this network of over 600 experts involved?
Wow. So it's more than just handing out a rule book. What else do they do to help hospitals actually, meet these standards?
Oh, much more. They provide the detailed international standards, sure, the actual requirements, but they also offer practical training, advisory services to sort of guide hospitals, and specialized certifications, too.
Like for specific types of care?
Yeah, clinical care programs, even things like healthcare sustainability now, and JCI telehealth certification, which is obviously very relevant.
And I noticed they have these specific goals, international patient safety goals.
Yes, those are really important. They focus attention on specific areas where historically patient safety risks tend to be higher, problematic areas, basically.
Things that commonly go wrong.
Precisely.
Yeah.
And they also have initiatives like patient safety pathways and this idea of JCI continuous accreditation.
Meaning it's not just a one-off check.
Right? It's an ongoing thing. They keep refining, too. They're on their 8th edition standards for hospitals now.
And the sources mentioned some real benefits for hospitals that go through this. What kind of things?
Well, beyond just the recognition, what's interesting is the internal impact. The process often forces better teamwork, better communication within the hospital walls.
Which you need for safety.
Absolutely fundamental. It also gives them a competitive edge, builds community confidence, sharpens up their risk management, and maybe the biggest thing, it helps foster a real culture of patient safety.
So it's not just about compliance, it's about changing how the place thinks about safety.
You got it. Trying to bake it into the hospital's DNA, so to speak.
Okay, now bringing it closer for listeners in India, there's a parallel body, right? The National Accreditation Board for Hospitals and Healthcare Providers, NABH.
That's correct. NABH fulfills that same essential role, but it's specifically tailored for the Indian healthcare system. It's part of the Quality Council of India.
Setting the benchmarks within India.
Yes, establishing and running accreditation programs, really driving progress for the industry there.
And it's set up to be independent, even though it involves different groups.
Yeah, the structure gives it full functional autonomy. It gets input from industry, consumers, government, but makes its accreditation decisions independently. The sources mentioned they provide resources too, like a digital health toolkit.
Okay.
And info on the specific benefits of accreditation in India, plus how hospitals can get hold of their standards.
All right, so we've got these big bodies, JCI, NABH, setting the high-level standards.
Yeah.
But let's bridge that gap. How does that connect to you, the patient, and specifically the medicines you might be given?
This is where it gets very real for the individual. A absolutely crucial area is medication monitoring.
Medication monitoring. What exactly does that term encompass?
It's basically the whole process of tracking and managing the medications you're prescribed, making sure they're taken correctly, right time, right dose to get the best results, and, importantly, avoid risks.
And it's not just the doctor's job.
No, the sources really emphasize it's a collaborative effort. It involves the patient, the providers, and any caregivers, too. Everyone plays a part.
Why is it so important? What's really at stake if this isn't done well?
Well, quite a lot. First off, good monitoring is how you and your doctor know if the treatment is actually working.
Right. Does it need adjusting?
Exactly. It allows for those necessary tweaks, maybe change the dose, maybe switch meds entirely. It enables that personalized care.
Personalize how?
By tracking, you can spot things like potential allergies you didn't know about, or how a new drug interacts with something else you're taking, even supplements. It helps tailor the plan specifically to you.
And it sounds like a major safety net against mistakes.
It's a critical safety net. Good monitoring significantly cuts down the risk of medication errors, taking the wrong pill, missing doses, that kind of thing. And that, in turn, helps prevent complications, even readmissions to the hospital.
Okay, so flip side. What are the real dangers if medication monitoring is poor? What did the sources highlight?
The risks are pretty serious. You could have dangerous drug interactions if meds aren't tracked properly, or harmful side effects from missing doses or mixing things you shouldn't.
Or just getting the amount wrong.
Absolutely. Too much can lead to toxicity or bad side effects. Too little. Well, the drug might not work effectively or at all. Your condition could get worse.
And if your condition worsens because the meds aren't right?
Then you often end up needing more doctor visits, maybe trips to the ER, potentially another hospital stay, which, besides the health impact, also means higher costs.
Right. It hits the wallet, too.
Definitely. So poor monitoring isn't just inconvenient. It can directly lead to less effective treatment, more danger, and higher expenses.
That really drives home why being proactive about monitoring is so crucial.
Yeah.
Okay, so how do we actually do it? What are some of the best practices or tools that can help patients, caregivers, doctors?
There are several practical steps. Regular check-ins with your provider, your doctor, or your pharmacist are key. Just sitting down and reviewing the current plan.
Makes sense. And using tools seems like a big recommendation.
Yeah, definitely. Using medication management tools comes up a lot. And that can range from really simple things like a basic pill organizer.
The plastic boxes with days of the week.
Exactly. All the way up to more sophisticated tools like smartphone apps or special packaging from the pharmacy.
What else helps?
Patient education is huge. Understanding why you're taking something, how it works, that really boosts adherence and safety. And don't underestimate family and caregiver support.
Having someone else involved?
For many people, yeah. Someone to help with reminders, maybe organize the pills, offer encouragement. It can make a massive difference, especially with complex schedules or if someone's memory isn't sharp.
The sources mentioned some specific tech tools. Compliance packaging. What's that?
Ah, right. Compliance packaging, sometimes called multi-dose packaging or blister packs. It's where the pharmacy packages your meds together by dose.
So instead of multiple bottles?
You get a packet clearly labeled with your name, the date and time you need to take it, and all the pills for that specific time are right there inside. Some are even color-coded or have QR codes for tracking. Really simplifies things if you take multiple medications.
That does sound useful.
Yeah.
So what about intelligent reminder devices?
Yeah, things like the dose minder were mentioned as an example. These are devices that can hold those compliance packs securely. They often link to an app, like the My Doses app mentioned.
They remind you.
They give you visual cues, maybe sound alerts when it's time for a dose. Some can even record video or create timestamped logs showing you took the dose, which you can share with caregivers or doctors.
Pretty high tech. But it sounds like the simpler stuff is still effective.
Oh, absolutely. The sources were clear on that. Basic pill organizers, setting alarms on your smartphone, even just keeping a medication journal or log in a notebook. These are all good, valid ways to track things. The main goal is consistency and accuracy, whichever tool works best for you.
Okay, let's focus on a specific scenario. Being in the hospital or a clinic. You know, medicines are often just given to you by staff. You might feel less in control, maybe a bit groggy. Why is tracking what you're given there so important?
That's a really critical point. In that busy hospital setting, like the sources point out, meds might be given quickly, maybe without a full explanation, especially if you're feeling unwell or anxious.
And that creates risks.
It does. You might not know what you're getting, which raises worries about allergies. There's a risk of getting a duplicate dose if communication between shifts isn't perfect. And it can lead to confusion later on when you're discharged and trying to figure out what you're supposed to take at home.
So, what are my rights as a patient? Before someone hands me a pill or gives an injection, what should I know?
You absolutely have the right to ask, and you should ask. What's the name of this medicine? What is it for? What are the potential side effects I should look out for? And crucially, can you confirm my allergies were checked against this?
Even asking how often you'll get it.
Yes, asking the frequency is good too. And even if it's an emergency where things happen fast, you still have the right to get that information as soon as things stabilize.
Okay, knowing your rights is one thing, but practically speaking, you're in the bed, maybe hooked up to things. How can you actually keep track?
The sources suggest some simple practical methods. Keep a small notebook and pen by your bed. Just jot down the date, time, the medicine name, and don't be shy about asking staff to spell it out.
Right.
The dose and what they told you it was for.
What about using the hospital's own records? Can you see those?
You can certainly ask to see the medication administration record, the MAR chart that the nurses are using, and definitely always ask for a clear copy of your final medication list when you're discharged. That's vital.
Could you use your phone, maybe take pictures?
With permission, yes. Photographing labels on IV bags or pill packets could be helpful, especially if you're a caregiver managing things for someone else. It creates a visual record.
And the idea of confirming before every single dose that was emphasized?
Incredibly important. Just asking, remind me, what is this one for? Before you take it. It's not being difficult. It's not showing distrust.
It's being responsible.
Exactly. It's being a partner in your own safety. It's a simple double check that reinforces the 5 rights: right patient, right drug, right dose, right route, right time.
Are there specific warning signs that should make you pause and definitely ask questions?
Yes. If someone brings you a new pill you weren't expecting, without explanation. If you experience any adverse reaction, suddenly feeling very drowsy, getting a rash, feeling nauseous, dizzy, report it immediately.
What else?
Another big red flag is if the staff seem hesitant or unsure, maybe about the dose. Or if they stumble over your name, that raises the risk of a mix-up. And absolutely speak up instantly if they try to give you a medicine you know you're allergic to.
It sounds like family or caregivers are absolutely vital here, especially if the patient isn't fully alert or able to advocate for themselves.
Invaluable. They are that extra set of eyes and ears, noting new medications, asking the nurse or doctor about side effects or interactions, and just having the confidence to say, hang on, that doesn't seem right, or can you double check that?
And let's circle back to that discharge tip. Really going over the prescriptions before you leave.
Non-negotiable, really. Before you head out the door, someone, a nurse, a pharmacist, a doctor, should sit down with you and go through every single medication.
Clarifying what to keep taking, what to stop.
Exactly. Which ones are new, which ones you need to pick up from the pharmacy, how long to take them for, and insist on getting a clear, easy-to-read written list. This avoids so much confusion and potential error once you get home.
Okay, so we've covered the standard bodies setting the quality bar and the patient's critical role in their own safety, especially with meds. Where do things like healthcare consultancy services fit in? The sources mention Supremedic as an example.
Right. Consultancy services like that work more behind the scenes. They're the support system for the hospitals, helping them actually achieve those high standards set by JCI or NABH and run efficiently and safely.
They help build the infrastructure and processes.
Exactly. They help hospitals put in place the robust systems needed for quality care, which definitely includes safe medication practices.
And the range of services they offer looked pretty broad.
It is. Everything from the initial planning and design of the hospital building itself.
Really, from the ground up.
Yeah, sometimes. And implementing quality management systems, specifically helping hospitals get ready for accreditation like NABH or NABL for labs. They also advise on buying and installing critical medical equipment.
Things like operating rooms.
Right. Setting up specialized things like modular OTs. Those are the modern, often prefabricated operating theaters designed for high efficiency and sterility. And ensuring things like medical gas pipelines are installed correctly and safely. All that infrastructure is foundational for patient safety.
And it's not just the physical stuff, but how the hospital runs too.
Precisely. They help with hospital operations management. That means developing standard operating procedures, SOPs.
Step-by-step guides for everything.
Exactly. Restructuring departments if needed, implementing the hospital information systems, the HIS software.
Which manages patient data, appointments.
And critically, medication orders, dispensing, and administration records. Efficient operations powered by good systems directly impact how reliably and safely care is delivered, including meds. They even advise on recruitment and staffing,
Making sure they have the right people, well-trained.
which, as JCI also stresses, is vital. So, yeah, consultants help hospitals build that foundation and fine-tune their internal machinery to meet and maintain those high standards we talked about.
They help translate the standards into practice.
That's a good way to put it. They support hospitals in implementing best practices to manage operations effectively and improve performance, all aimed ultimately at delivering safer, better patient care.
Okay, so let's try and pull all these threads together. We've seen these accreditation bodies, JCI, NABH, setting the benchmark for quality and safety.
Setting the bar high.
Then you have consultants helping hospitals build the systems, the processes, the infrastructure to actually reach that bar.
Providing the support and expertise.
And then, crucially, there's the final layer, the vigilance and active participation of you, the patient, or your caregiver, especially as we focused on with medications.
What really comes through from all this is that healthcare safety isn't just there. It's not something you passively receive if the hospital's good enough.
It's more active than that.
It's an active, multi-layered collaboration. A partnership, really. The system, the hospital, provides the framework, the standards, the resources.
But your own vigilance, your questions, your tracking, that's the essential personal safety net.
Yes. And tracking your medicines, asking those questions, it's not about distrusting the staff. It's about being a responsible partner in your own care. It's for your own safety.
Everyone has a role.
Everyone has a role in making healthcare safer.
This deep dive really highlights how interconnected it all is, doesn't it? The big standards, the hospital's internal practices, and your individual actions. They all weave together to create that safety net, especially around something like medication. And understanding the systems, like accreditation, knowing they exist, and then actively participating in your own care, like tracking meds. These feel like powerful tools against just feeling overwhelmed or, at risk.
It's about empowering yourself within that system. Being informed, being engaged, that's probably your best defense.
Definitely food for thought. So here's something to maybe mull over. We know medical treatments and the whole healthcare system are getting more and more complex. How might technology evolve further? How can it make this partnership even easier, both for hospitals and for patients? Really empowering everyone to ensure safety and understanding.
That's a fascinating question. There's so much potential there. And maybe just think about how you could apply some of these simple tracking methods we discussed today for yourself, or perhaps for someone you help care for.
Because that little bit of vigilance, armed with some understanding, it really can go a very long way.